Hi everyone, today we're talking about Nissen Fundoplication surgery and the post-op diets that are followed. Nissen Fundoplication surgery is a surgery for patients who have gastroesophageal reflux disease, otherwise known as GERD. These patients haven't been able to get relief from medications or other interventions, and so they need surgery. So in this procedure, they take the top of the stomach, which is called the fundus, and they wrap it around the esophagus and surgically seal it together. So this is what the stomach and esophagus look like after the surgery. This will help prevent reflux, so it helps prevent the contents of the stomach from coming back up into the esophagus. After the surgery, the patient's stomach near where the esophagus is, so where the esophagus brings the food down from the mouth into the stomach, that's very narrowed. So the patients need to start with liquids and then slowly advance to softer food so that nothing gets stuck going from the esophagus into the stomach. At our facility, we follow a 3-stage post-op diet. So for days 1 through 7 after surgery, they're on our stage 1 diet, which is also called the Nissen early post-op diet. On day 8 to 10, they follow the stage 2 diet, which is called the progression diet. And day 11 and beyond, they follow a soft diet. And sometimes they need to be on this diet indefinitely to be sure that their body can tolerate swallowing and getting things to their stomach. The stage 1 post-Nissen diet it looks a lot like the full liquid diet, although it doesn't have oatmeal or cream of wheat. It allows yogurt, and also included on this diet is Ensure because they need good sources of protein and calories to heal. We also stick to lower lactose things like lactose-free milk or soy milk. Anytime you have surgery on your digestive tract, your ability to digest lactose can be impaired. So to err on the side of caution, we stick with the lactose-free items. The post-Nissen stage 2 diet starts with, it's basically everything that's on the stage 1, what we just saw, but they start trialing thicker and thicker items. And the way the surgeon wants them to do it here is to take their nutrition supplement drink, so their Ensure, and start thickening it until it's eventually as thick as applesauce. So most patients are already home when they're on the stage 2 diet. They only stay a couple of days after surgery. But sometimes they need to come back in, or they have to stay for whatever reason, and then we will thicken it here for them. So at home, we've taught them to use rice cereal to thicken the Ensure, but here we would use our Thicken Up product. So if the patient can tolerate these thickened shakes on day 10 after surgery, they can then transition to the soft diet, the stage 3 diet. This is a big list, but these are the foods that are not allowed on the stage 3 diet, the soft diet. It looks a lot very similar to our other non-dysphagia soft diet, but there are a few differences. So higher fat foods are limited because higher fat foods stay in the stomach longer and can cause reflux to happen. So we ask them to avoid anything that's fried or very fatty. Raw vegetables, raw fruits are not recommended. More softer things. Also, they have to be careful of chocolate, caffeine, carbonated beverages. All of these things are irritating to the stomach and also could cause gas. So we really don't recommend any carbonated beverages for the first 8 weeks after surgery. chocolate, peppermint, all of those things can be very irritating to the stomach and esophagus, so those are we ask them to avoid. Also, spicy food can be very irritating, so they are advised to avoid very spicy things. Some other things to consider, we recommend when they're on stage 3 that they eat small, frequent meals so they can get everything they need in by the end of the day. So while they're here, they may ask for snacks, or they may ask for 2 lunch trays spaced out. On the stage 3 diet, they're advised to drink their liquids separately from their meals, only to drink about half a cup with their meals, and space that out, because if you think about it, if you're drinking a lot and eating a lot at a meal, that takes up a lot of room in your stomach and can make their reflux come back. Also, patients are advised to take small bites, chew their food well. Digestion starts in the mouth, so the more they can break that down in the mouth, the easier it will be to swallow. And then we do not give them straws. That helps to avoid gas. So now let's take a look on how you order these diets and meal trays in Health Touch. Okay, the Nissen Stage 1. As you can see, it's the full liquid menu, but it's been edited down to what they can and can't have. Soy milk is allowed. If you go to the beverage screen, you can also get to the lactate. Also, they're allowed to have low-fat vanilla yogurts. But things like the oatmeal and cream of wheat that we normally allow on full liquid is not allowed. If the patient isn't choosy about what they want to eat, you can use either the breakfast, lunch, or dinner button to give them a standard tray. And one thing to note on this diet is that the standard tray will include Ensure, and this is a diet similar to our bariatric surgery diets where Ensure is automatically included. You won't need an order or a note for it to send it. So keep that in mind. Good old Health Touch is taking a while to load this. Okay, so there is a standard tray that includes Ensure. The stage 2 diet, let's take a look at that. Again, it's the full liquid menu with additional items available. The biggest difference on here is the supplement will come automatically honey thick. And the reason for that is, again, to get their body ready to have bigger and bigger boluses and eventually move to the soft diet. And even if you choose the breakfast, lunch, or dinner button on this, it will print the Ensure that's honey thick. And sometimes the kitchen will question this, like, why are they allowed to have thin liquid jello and thin liquid broth, but the Ensure has to be thickened? But now we know it's to help their body get ready for that bolus. And then the stage 3 soft diet has soft items on it. Things that the surgeon has specified not to be allowed are not here. So breads and toast are not allowed. Things with lactose are not allowed. So this has all been very specialized by the surgeon for what he wants for his post-surgery. If you have any questions, let me know.